Nightingale, a British nurse born in 1820, is most famous for her work in educating hospital nurses and in establishing the St. Thomas Hospital.
However, less well recognized are her efforts as a sanitarian and social reformer. She was especially concerned with the care of the sick poor in workhouses, as well as the quality of life in their homes and in the slums, and the problems of prostitution and crime that such conditions created.
Nightingale was also very skilled in mathematics and was far ahead of her time in understanding the importance of health data. She, however, unsuccessfully petitioned to Parliament that in their 1860 census they should include data on sickness and disability. Florence Nightingale demonstrated her passion for public health when in January 1864 she co-authored the paper Suggestions in Regard to Sanitary Works Required for the Improvement of India Stations. Say that 3 times fast.
During Florence's lifetime, the Crimean War was raging. Newspaper reports of unsanitary conditions at the military hospital had aroused the public, and the Secretary of War responded by getting together a team of nurses to address the situation. The secretary was a good friend of Nightingale's and knew about her amazing leadership skills, so Nightingale and her team arrived in Turkey at the end of 1854. They found the hospital conditions were far worse than actually reported. The wards were overcrowded, patients were covered with soiled rags of dried blood and excrement, and the water supply was contaminated. According to Nightingale, the hospital case fatality rate during the first months after her arrival was 32%. Although Nightingale did not accept the concept of bacterial infection, she despised crowding and unsanitary conditions. She put her nurses to work sanitizing the wards and bathing patients. Nightingale addressed the problem of providing decent food and water and ventilating the wards. Within 6 months, the hospital case fatality had dropped to 2%. Florence Nightingale's influence on modern healthcare ranges from her ward designs, known as Nightingale wards, which were developed to positively affect the health and recovery of patients, pioneering infection control methods, and her discovery that a healthy diet is essential for recovery. Florence also believed in the need for specialist midwifery nurses and established a school of midwifery nursing at King's College Hospital, which became a model for the rest of the country. Nightingale is also credited with inventing the pie chart, which is widely used today in all mathematical fields and in statistics, especially health record statistics and research. She inspired the founding of the International Red Cross, which still awards the Florence Nightingale Medal for nurses today.
Today, Florence Nightingale continues to inspire hardworking nurses across the world. She also inspires public health workers as well. Because of her trailblazing efforts and advocacy for the poor, health data statistics, and public sanitation methods, public health would not be what it is today without her.